Good day, everyone. My name is Chelzey Oñate from Political Science 1 of the De La Salle University Dasmariñas, and I'm here to discuss my paper for our Political Economy course. My paper is entitled Shedding the Cold-Blooded Conduct, Snake Antivenom Access as a Failure of Health and Agricultural Governance in the Philippines. As the title states, my paper centers around the issue of snake envenoming here in the Philippines. And according to the World Health Organization, snake bites are a priority neglected tropical disease. The Philippines is home to at least 40 species of venomous snakes, and their bites can be fatal within hours of the bite. And this primarily affects farmers, fishers, and agricultural workers, and as we all know, they are the backbone of any agricultural country such as the Philippines. They hold up the economy and as well as the food supply. I argue in my paper that there is no lack of scientific knowledge, scientific technology, or even antivenom themselves, but there is a lack of making supply and delivery of this antivenom in rural areas where it is most needed, and it is because of the political and economic failures in the system. Specifically, I identified three failures or issues here in the Philippines. First, there is a governance failure. Second, there is a market failure. And third, there is an intersectoral neglect. First, there is a lethal governance gap. The Philippine system is devolved with national agencies like the Department of Health and RITM controlling the antivenom supplies, but local governments are responsible for delivery. This creates an accountability vacuum, with antivenoms piling up in city hospitals, while rural clinics near farms where incidents happen are left empty. For farmers bitten in remote fields, the journey to the treatment is often long and too late. And for the second issue, the market failure, the market is broken. Producing antivenom is complex and expensive. The primary victims are rural workers with low purchasing power, making it unprofitable for private companies to produce enough. The state's underinvestment means supply is fragile and costs are catastrophic for farming families or agricultural families in general, which pushes them into medical debt. A vial can cost around 5,000 to 7,000 or even higher per vial, which is too expensive for many families here in the Philippines. And third and last issue is the intersectoral neglect. The snake bites incidents or snake bite envenoming in general falls between the cracks of the Department of Health and Department of Agriculture. The Department of Health sees it as a low priority medical event, while the Department of Agriculture doesn't treat it as an occupational hazard. With no formal coordination, there is no unified strategy to battle this issue. A lack of reliable surveillance data also makes the crisis statistically invisible, allowing the cycle of neglect to continue. In my paper, I concluded that this antivenom crisis reflects broader failures in how the Philippine state values rural lives and labor. And to break this cycle of neglect, I propose integrated solutions to counter these issues or to improve the system. Number one is immediate action in stocking and supplying antivenoms in regional hospitals and rural clinics where these incidents primarily happen, and also launch public health campaigns in this rural communities or agricultural communities so that they will know or they are informed of what to do when they encounter venomous species of snakes, and also what to do if something or someone is bitten by the snakes. Second is economic intervention. The government can subsidize production and explore regional partnerships such as within the ASEAN sphere to lower the cost and yield better results, because the ASEAN is also home to many species. The ASEAN as a whole is home to species of venomous snakes, and there are also many incidents in this region. So, third and final is to create a sectoral partnership and collaboration between the Department of Health and Department of Agriculture regarding this issue. There should be a task force to address the information vacuum and improve the snake bite surveillance, and also integrate prevention into agricultural safety programs. So, and that concludes my paper. Thank you very much for watching.